Welcome to mdsource, your source to helping you become a more informed you, with plastic surgeon Dr. Rod Rohrich. Fillers, Botox, and using your own fat.
Do you know the differences between fillers, Botox, and the use of your own fat in your face? Many people don't. This is a very confusing topic to my patients. We have all seen the Hollywood types in the gossip magazines who've been done an incredible disservice by practitioners or doctors who sometimes call themselves plastic surgeons. One of the most common causes of the dreaded Hollywood look is the overuse and misuse of fillers to address sagging when it was not indicated, or they should have had surgery instead. So knowing the differences between fillers, Botox, and your own fat is very important. First of all, fillers are used to add volume to your face when you've had volume loss and you've not reached the point yet of sagging in your cheeks. Once sagging starts in, falls in, or sets in, fillers won't do. You must stop fillers when you sag or you'll look like the Stay Puft Marshmallow. One of the most common mistakes that inexperienced physicians and other practitioners make is the excess promotion and use of these products, believing that fillers can indeed lift and fill for an easy fix. They simply cannot. When overused, they create a very overfilled and fake appearance. The lesson here is make sure you're getting the right filler, put in the right place, and you're in the hands of the right surgeon, which includes either a board-certified plastic surgeon, a board-certified dermatologist, or facial plastic surgeon with board certification in otolaryngology, or an oculoplastic surgeon who's board certified, who is well versed in the use of these fillers. Don't allow someone who's just working in a spa or not professionally trained to inject anything into you ever. The most commonly used fillers are the following. The HA or the hyaluronic acid fillers are safe and reversible. The volumizing stimulators such as Radius and Sculptra, which last longer but must be injected deeper. And Botox, which is a botulism toxin type neuromodulator. And the word Botox has become generic, but it really refers to other FDA-approved neuromodulators, including Xenamin and Dysport. These are all excellent FDA-approved neuromodulators. They all work by temporarily weakening the muscles around the face or the eye to help soften the wrinkles. They all last about 3 to 4 months. That's important. But what about fat transfers and using your own fat as a filler? Fat transfers have taken on an incredible important role in facial rejuvenation today. Fat makes a wonderful natural filler for the face. It does require an operation, however. In specific instances, it works well for augmenting breasts and buttocks, as well as other parts of the body as well, to create a natural look. Fat transfers have been a tremendous adjunct and made a big difference in facial rejuvenation today, as the first sign of aging in the face is a loss of fat in the central part of the face. So injections of fat into the deep fat compartments called the malar areas, along with other fat compartment fat injection, addresses the issue in a way that makes facelifts alone not look good. Injections of fat into the deep cheek areas or compartments of the face are an incredible adjunct to making facial rejuvenation look natural and last longer. There are 5 key points to remember. Fillers fill, they don't lift. So if you're experiencing significant sagging, don't get a filler. Number 2, soft tissue fillers like hyaluronic acid fillers are excellent. They're safe and they're reversible. However, don't overuse them or overdo them. Both are bad. There are other volumizing fillers like Radius or Sculptra that must be injected deep, and they certainly do last longer. These are not reversible, but they're not permanent long-term, so they may last up to 18 to 24 months. Number 3, Botox and other FDA-approved neuromodulators, including Dysport and Xenamin, soften the wrinkles and lines around the eyebrows and the face and work well for 3 to 4 months. Number 4, fat is your own and perhaps the best filler. However, it is more labor time intensive and it needs to be done in an operating room in a sterile manner. It is best injected into the deep facial fat compartments and will last longer than fillers in most cases. Number 5, demand that you have an expert injector who understands facial aging and comes from one of the 4 core cosmetic surgical specialties, which includes plastic surgery, ENT, dermatology, or ophthalmology. Fillers, Botox, and surgical facial rejuvenation have different indications, and your expert injector must understand when to do it, where to do it, and when to not do it, and when to then transition to true surgical facial rejuvenation.
mdsource with Dr. Rod Rohrich, helping you become a more informed you.